Hi guys, we'll be discussing about infant deaths now. Here, so the infant is a child which was less than 1 year age, and we'll be discussing about the different aspects in the infant deaths. To start with, let us see few important aspects. You can see that this is the pregnancy period, right? This is the pregnancy period, and you can extend it up to 1 year. Let us say this is delivery, or you can say birth, and this is 1 year, right? And here you have a landmark, that is 210 days, or you can say 28 weeks of gestation. That is the period of viability, right? This is 28 days, right? And this is 24 hours. Let us say these are the important timeline that we have to know. If there is killing of fetus, throughout the period of gestation, right? Throughout this period, if there is killing of fetus, we call this as feticide. And this killing of fetus is done by the parent. If it is done by the parent, then we use the terminology that is filicide. Right? So feticide and filicide. Killing of the fetus is feticide. Killing of the fetus by the parent themselves, it is filicide. Now, you know that the infanticide is a term that you can extend it up to the age of 1 year. If there is killing of infant, right, less than 1 year of age, you can say that is infanticide, the entire stretch of 1 year, right? Now, suppose if the neonatal period is less than 28 days. If there is any death occurring in this period less than 28 days, you can call it as neonatal death. But there is one more terminology that is called neonaticide, right? Neonaticide is a killing of the neonate, right, within 24 hours. This is neonaticide. There is a difference between neonaticide and neonatal death, right? So I've given you all these terminologies, right? So in this thing, we have discussed about all this terminology. I told you infanticide, feticide, filicide, neonaticide. I've also told you neonatal death. But what are the legal implications, right? Do remember, there are three important sections that is important in this. Number one, you have to know it is 302 IPC, right? Why it is 302 IPC? You know very well, 302 IPC is a section that gives punishment for murder. Is it not? See, the point is infanticide. Punishment for infanticide, it is given by 302 IPC. Punishment for infanticide. That means there is no difference between killing of an infant and killing of an adult, right? There is no difference between killing of an infant and killing of an adult. Both, right? As per Indian law, both remains the same thing, right? It is murder. It amounts to murder. It is punishable under 302 IPC. Right? So infanticide is not punishable under any other section. There is no separate section for us as per Indian law. It is the same section, that is 302 IPC. Let me give you one important case scenario. You can see it is a case of S.K. Harrison with state of Delhi. What happened? You can see that in this case, the accused was working in Indian Navy. He met his wife and his infant son of 4 months. The infant son is only 4 months old at his parent house, right? He just returned from the duty. The accused had always had an history of violent behavior towards his wife. On that particular day, 28th June of 1990, he accused her of chastity, right? And upon coming back from the work, right, what happened? In a fit of rage, he became so arrogant. What happened? This person, the accused, snatched away the baby from the mother, right? And he swung the baby in the hair. During this particular act, what happened? The baby head hit the bedside, right? And not only that, here what happens? The person, the accused, continuously kept on hurting the baby until the baby died. Right? While committing this act, the accused has also put the tape recorder in a full volume so that the cry of the baby is not audible from outside. This noise of the radio is going to mask the infant cry. It doesn't reach outside the neighbors. Right? But during the case, this person was arrested, the baby died, right? This person was arrested, he was charged with murder. But during the trial, the person, the accused, took a defense that while he was trying to get the baby from his mother, somehow the baby got slipped from his hand, baby fell on the ground and sustained head injury, and that is the reason for the head. It was not intentional killing by the father, right? He was only contending that it was the death of the infant is only accidental, it was not murder. But with the available facts, the court convicted him with the death, with the murder, 302 IPC murder charge. Even the Supreme Court also upheld the decision, that is 302 IPC. Do remember, it is the death of an infant, infanticide, it punishable under 302 IPC, right? 302 IPC, you need to remember. Now, there are two other sections that you have to know with regard to this. Number one, 315 IPC. Another one is 316 IPC. Right? 315 and 316. What are these two important sections? These two important sections are related to unborn child. It is not about born child. Born child, does infanticide, 302 IPC. This is unborn child. What happens? 315 and 316. So 315 IPC states that any act done with the intention is there, to prevent the child being born alive. The child should not born alive, or it should die inside the uterus itself, or even it is born, it should die immediately after death. Right? So that is the intent, and the act is done with this particular intention. Any act done with the intent to prevent the child being born alive, child should not born alive, or even it is born, it should die immediately after birth. Right? So any act done with this intention is punishable under 315 IPC. Very important. Right? Another important section is 316 IPC. What is a 316 IPC? It states that it gives a punishment for causing death of a quick unborn child. Again, it is unborn child. It is not born child. Right? They used to say infanticide is punishable under 316 IPC. That is wrong. But these 316 IPC is related to unborn child. Right? It causing death of an unborn child, it amounts to culpable homicide. It amounts to culpable homicide. Right? 315 IPC, the acts, it is punishable. 316 IPC, it is causing death of a unborn child, it resulting in, it amounts to what is called as culpable homicide. Particularly here, what happened? 316 IPC, suppose somebody is got the intention to kill the mother. A person has got an intention to kill the mother. He wants the mother to die. He takes a knife, he stabs her in the abdomen. Right? There is a stab injury abdomen. It has pierced, it has caused rupture of the uterus as well. The mother escapes. The mother survives of this particular injury, but the fetus dies. The baby dies. With the intention of killing her mother, the baby dies. Remember, 316 IPC is punishable. 316 IPC is applicable. Right? So 315 IPC, 316 IPC, do remember both are applicable for unborn child. Right? Unborn child. The baby is still inside the uterus. Right? Still inside the uterus. So let us talk about three important terminologies. We have three important terminology. One is dead-born, another one is stillborn, and the last one is live-born. What is dead-born? Dead-born child is a child that is died inside the uterus itself. It is dead inside the uterus, intrauterine death of a baby. Right? IUD, or you can say dead-born. Right? What is stillborn? Stillborn is a child which is born after 28 weeks of pregnancy. That is important. But it is not breathing, not showing any signs of life after being completely born. It is born, but still it is not showing any signs of life. Even it is after 28 weeks, we call it as stillborn. That means it is died during the process of delivery. Right? And the last one is live-born. Live-born, as the name implies, the baby is alive. Here, there is complete expulsion of products of conceptus anytime during pregnancy, and the child is breathing, showing any sign of life. If the child is breathing or showing any signs of life, you can say that is live-born. This is as per Registration of Birth and Death Act. Right? So this definition is as per Registration of Birth and Death Act. Complete expulsion of the products of conception anytime during pregnancy, but still the baby is breathing, showing any signs of life after being completely born. Right? So dead-born, stillborn, live-born. We'll be talking about the signs of dead-born first. What are the signs of dead-born? How do you say the baby is dead inside the uterus? Number one, rigor mortis. If the just born baby shows rigor mortis, definitely that is a sign of dead born. right? Number 2, if it shows maceration, if the baby shows signs of maceration, or if the baby shows mummification sign, or if the baby shows putrefaction, all this will suggest that the baby is dead inside the uterus itself. Right? The baby is dead inside the uterus. Rigor mortis, maceration, mummification, putrefaction. When any of this sign is found in the baby which is just born, you can definitely say the baby is dead inside the uterus itself. Right? I told you maceration can be there, mummification can be there, putrefaction can also be there, but what is causing all these changes? Right? Let us discuss about that. Let us say that this is your uterus. This is the uterus. Right? This is uterus. Fine. And this is the amniotic sac. Inside the amniotic sac, you are having the baby. Right? Baby is there. You can see in this situation, baby is dead. This baby is dead, unfortunately. But see here, the sac is intact. Intact sac is there. That is important. Intact sac is there. When the sac is intact, external air cannot go inside. No air has gone inside. But now, if you have lot of excess amniotic fluid is there. If there is excess amniotic fluid, that will cause autolysis of the baby. That autolysis of the baby is called as maceration. Right? You can see intact sac, no air and excess liquor causing maceration. Similarly, if there is intact sac, no air, but there is deficient liquor. Not only that, there is ischemia. Right? There is no blood supply. It results in dehydration of the baby. The dehydration of the baby causes what is called as mummification. Right? That will cause mummification. Fine. So, I hope you found the difference. What is the difference? If there is excess liquor, it results in maceration. If there is deficient liquor with ischemia, it results in mummification, dehydration. Now, I'll tell you another important possibility. What is that possibility? Let us say again, this is the uterus. You can see this is the uterus and this is the amniotic sac. But here what happens? The amniotic sac ruptures. There is rupture of the membrane. Right? You can see when there is rupture of the membrane, the bacteria from outside will gain entry inside. Right? Whenever bacterial disintegration is there, you know that process. What is that process? That process is called as putrefaction. Right? So that means when there is intact sac, you might get maceration or mummification. When there is rupture of sac, you might get putrefaction. That is very important because the sac is ruptured, air entry is there. Fine. So these are the 3 important things that we have to know. Right? So we have seen dead born. I told you the conditions: rigor mortis, maceration, mummification and putrefaction. Before going to this maceration, now let me tell you what is viability. What do you mean by viability? Viability is not a condition, it is an ability of the fetus. It is the ability of the fetus to lead a separate existence outside his mother. If you take the fetus is inside the mother. If you take the fetus outside the mother, when there is a separation of the fetus from the mother, whether the baby is able to sustain or not, whether the baby is able to survive or not, that is called viability. Right? It is the ability of the fetus to lead a separate existence outside his mother, right, by virtue of its development. Right? By virtue of its development. Based on the development of the baby, whether the baby is able to survive out or not, that is called viability. As per Indian law, the Indian law does not give you any period of viability. Clinically, it is taken as 28 weeks of gestation. But it will vary depending on the available infrastructure in the hospital. 180 days, right? There are so many instances where the baby born before 200 days also, but still the baby is able to survive. That is all depending on the infrastructure in the particular hospital, neonatal care, right? Fine. So, but what you have to know is you just need to know the definition of viability, ability of the fetus to lead a separate existence outside its mother by virtue of its development, right? By virtue of its development. Now let us discuss about the most important condition for examination, that is your maceration. Right? For a baby to get macerated, what is needed? The sac has to be intact. The sac has to be intact. No air entry should be there inside. And there should be excess liquor. Right? In all these situations, it will result in autolysis, right? Autolysis of the baby, we call it as maceration. And that is the reason why we call this as aseptic autolysis, because you know very well, autolysis means without bacterial involvement. That's why it is called as aseptic autolysis. Maceration is otherwise called as aseptic autolysis. Let us look at the features that you can see here. What you can see is the earliest feature is skin slippage. Right? You can see the skin slippage. Not only the skin slippage, you can also see the reddening of the skin. Right? You can also see the reddening of the skin. This is the earliest sign that can be seen as early as 12 hours. If you keep your finger, press it, the skin will slip. Right? You can see the slipping of the skin, that is the skin slippage. Reddening of the skin, the copper brownish tint, staining of the skin, that is reddening of the skin, that is also one of the important signs. Right? All these are earliest. After which we will find skin blebs. We can see the skin blisters. Not only that, we will also be able to find out the soft and flaccid baby. The baby parts become soft and flaccid. See, normally when you keep the baby in a table, let us say this is the table, you keep the baby, you may have curvatures because of the tone of the muscle. But here, because the baby is completely soft and flaccid, you keep the baby on the floor, it is so flat. Right? Completely flat on the baby. On the table. The baby is completely flat on the table. That is because of the soft and flaccidity that is developed. Right? So skin blebs, it will take 24 hours and this one 2 days. Smell of the baby. What is the smell of the macerated baby? We say it is sweetish smell. You can say sweetish disagreeable smell. Sweetish disagreeable smell will be there. And look at the joints will be hypermobile in all the directions because the ligaments will be so soft you can move it in any direction. We call it as hypermobile joints. Hypermobile joints. Fine. So these are all the external features. You have other features as well, but these are all the common features that is important for examination purpose. Right now I'll tell you the radiological features that you can notice. What are the radiological changes that you can see? Right? Number one, what you can find out is, you can find what is called as Roberts sign. Right? What is this Roberts sign? Roberts sign is the presence of gas shadow. You can see the presence of gas shadow in the great vessels. Right? Maybe in the heart, maybe in the aorta, right? Sometimes in the umbilical arteries, right? All these places will be able to find out the presence of gas shadow. We call it as Roberts sign. Remember, this is also seen as early as 12 hours. Number two, the next important radiological sign is your overcrowding of the ribs. See, normally what happens when the lungs are collapsed, because of the lung collapse in maceration, there will be overcrowding, or ribs will come close to each other. When you look at the x-ray, you can see overcrowding of the ribs. Right? And you will also find what is called as hyperflexion of the spine. See, normally the baby will be flexed, will be in flexion. But here, the baby's spine will be hyperflexed. You look at the shadow of the baby, it will be like a ball. We call it as ball sign. Right? We call this as ball sign. Right? There is one more very important sign here, that is called Spalding sign. What is a Spalding sign? This is one very common sign that you might have heard of. This is called Spalding sign. What happens here is, when the baby gets macerated, you can see the shrinkage of the cerebrum. When there is shrinkage of the cerebrum, it results in shrinkage of the cerebrum. We are talking about the brain. Whenever there is shrinkage of the brain, shrinkage of the cerebrum, the alignment of the vault bones will not be there. Right? So what happens? You can see the vault bones will override each other. You can see loss of alignment and overriding of the vault bones. This loss of alignment and the overriding of the vault bones is called as Spalding sign. Right? And this you can see, I think, around 4 to 7 days. Right? You can see it around 4 to 7 days after death. Overriding of cranial vault bones. Right? And the last important sign that you have to know with regard to this is called dual halo sign. What is the dual halo sign? It is the separation of the scalp from the vault. Because in a macerated baby, there is separation of scalp from the vault, skull vault, right? We call this as dual halo sign, which you can see radiologically. I can show you the macerated image. See, so far I have given you 5 important signs. Number 1, Roberts sign. Number 2, overcrowding of the ribs. I told you hyperflexion of spine. We call it as ball sign. Spalding sign. And the last one is dual halo sign. You can see this is the macerated baby. You can see the discoloration. You can also see the skin slippage, peeling. Okay. And this is your Spalding sign. You can note down the overriding of the wall to bones, loss of alignment. And this is Roberts sign. You can see the gas shadow, right? Gas shadow will be noted. All this is seen with your maceration. So once we have spoken about the dead born, now we'll be moving on to the next one, that is live birth, live born, right? What are the possible evidences of live born baby? On looking at the baby, how would you know that it is live born only? It is born alive, right? Maybe the cry of the baby, or any movements of the baby, muscle movements of the baby, right? You can say they are all possible evidences. They are not absolute evidence. They are possible evidences. They are not definitive evidence, just possible. Because cry of the baby, I told you the cry of the baby, this is important. Sometimes, see, cry of the baby normally happens when the baby has come out. But sometimes, even when the baby has not come out, you can hear the cry of the baby, right? When the cry of the baby happens, if the baby is still inside the uterus, this is called as vegetus uterinus. When the cry of the baby occurs, even when the baby is inside the vagina, right? The baby is inside the vagina, but still you are able to hear the cry of the baby. Baby cries when it's still inside the vagina. We call this as vegetus vaginalis, which was asked in your last year examination, right? Do remember vegetus uterinus and vegetus vagina. When it is inside the uterus, it's called uterinus. When it is inside the vagina, that is called vaginalis. Now, what are the most, I told you, possible evidences of live born? But what is most important evidence of live born? Respiration. That is the most important evidence of life. So let us see how to find out while you are doing dissection. While you are doing dissection of the fetus, the most important objective is to find out whether the baby is live born or not. Most important objective is to find out whether the baby has given breathing or not. So let us discuss all the findings related to that. Let us assume one baby has not respired, right? Another baby has respired. First baby has not respired, second baby has respired, right? Now look at the shape of the chest. When you can look at the shape of the chest, when it is not respired, it is flat, right? When the baby starts respiring, it will be expanded, right? It's quite logical, right? Self-explanatory. Now look at the level of diaphragm. See, you know very well, when we are doing dissection in a newborn baby, the first cavity that we have to open is abdominal cavity, because we need to insert the fingers, look for the level of the dome of diaphragm. Why? Because if the baby has not respired, it might be at the level of third or fourth rib. If the baby has respired, it will be at the level of sixth or seventh rib, right? Sixth or seventh, right? That means when the baby starts respiring, lungs will expand, pushing the diaphragm down. As simple as that. Now look at the lung. This is very important. Lung. What about the lung features? If the baby has not respired, you can see that this baby has not respired. You can see the baby lung, right? And this lung, this baby lung has respired. You can see this is the lung. Now what is the difference? You look at the margins of the unrespired lung. The margins of the unrespired lung, it is sharp. Right? It is sharp. Whereas the margin of respired lung, it is round. Right? Because it is expanded. Level of diaphragm. You can see third or fourth rib if it is not respired. Sixth or seventh rib if it is respired. That we know already. When you look at the nature of the lung, you can see surface of the lung, it is homogeneous. It is uniform. Right? It is uniform in color. And you touch the lung, you can see it is liver-like consistency. It is firm. It is liver-like consistency. Whereas you touch the respired lung, it will be crepitant. And look at the surface of the lung. You can see what you can see is you can find out mottling here and there. Right? These kind of mottling will be noted when it is a respired lung. When it is unrespired lung, you find a uniform, right, uniform appearance of the lung. So you can differentiate whether it is an unrespired lung or respired lung by looking at the appearance itself. By looking at the appearance itself. Now you want to weigh it. When you want to weigh it, you can just see the unrespired lung will be 30 grams, whereas the respired lung will be 60 grams. Right? And when you see histology, when you want to see the histology, the alveolus, it is not expanded and it is lined by cuboidal epithelium. At the same time, when you look at this respired lung, you can see alveoli are well expanded and it is lined by squamous cells. Squamous. Right? You can compare the alveolus. In unrespired, it is not expanded, whereas in respired, it is completely expanded. There are few tests that we can do for Liebon status. What are the tests that we have to see? Right? Number one, what is called as Ford's test. Right? Ford's test, wherein we are checking the weight of the lung. Right? Number two, what is called as Ploquet's test. See, Ploquet's test is a test. Here we are not checking only the weight of the lungs, right? We are also checking the weight of the baby. We are looking at the ratio, weight of the lung to the weight of the baby, right? There is one more test that is called Breslau's second life test, right? Breslau's second life test, wherein we are, see, it is also called a stomach bowel test, wherein we are looking at the stomach, right? Stomach, we are examining the stomach, right? Then we have what is called as Redden's test. Redden's middle ear test. Here we are checking middle ear of the baby, right? What are we checking in the middle ear? We'll be looking for what is called as gelatinous tissue, whether it is present or absent. That is what we are looking for. And the last but not least, we call it as hydrostatic test, which is also called as Breslau's first life test, right? It is called hydrostatic. I have given you the list of tests. I have not gone into the explanation. We'll be discussing on that so that you will have a better clarity. First, learn about the name of the test. Ford's test, Ploquet's test, Redden's middle ear test, Breslau's second life test, and the last one is hydrostatic test. Now let us look at the first test. First test is Ford's test, wherein we are checking the weight of the lung. You see, this is the weighing machine. You take the lungs, you weigh the lungs, right? You are checking the weight of the lungs, right? In Ford's test, what happen if I told you weight of the lungs, right? If the baby has not respired, it will be 30 grams. If the baby has respired, it will increase to 60 grams. That is because increase in the blood flow to the lungs. When the baby starts breathing, more blood will be given to the lungs and more blood flow. That is why the weight is increased, right? And this is your Ford's test. What is the next test? The next test is your Ploquet's test, wherein we are checking the ratio of weight of the lungs to the weight of the baby. Let us see Ploquet's test. You can see you are taking the lungs and you're also taking the baby, checking the weight. Now look at the ratio. If the weight of the lungs divided by the weight of the baby, look at the ratio. If the baby has not respired, 1:70, it will be converted into 1:35. If the baby has respired, that is because if the baby starts breathing, the lungs weight will increase. That is the reason why the ratio from 1:70 has become 1:35. This is called Ploquet's test, right? This is called Ploquet's test, wherein we are checking the ratio. The third test which I told you, that is called Breslau's second life test. I told you we are looking at the stomach. See, the concept is this. I'll tell you the concept. When the baby starts breathing, it will swallow some air. When the baby starts swallowing air, where does it go? It goes to the stomach. So what you have to do is take stomach, take a bowl of water, take stomach, ligate it, right? Put it under water. When you put it under water, still it is ligated. You put it under water. Now, under the water, try to make a cut, right? Or make multiple punctures. If there is any air which is present inside the gastric cavity, what will you see in the water? Yes, you will be able to see the presence of air bubble in the water. That will confirm the baby has got gas in the stomach cavity, which is suggestive of respiration. This test is called as Breslau's second life test, also called as stomach bubble test. What is the third test? The third test is called Redden's middle ear test. What is this Redden's middle ear test? I told you that we are looking for the gelatinous tissue. See, normally when the baby just born, you can have gelatinous tissue in the middle ear. Right? When the baby starts breathing, the eustachian tube will open, gelatinous tissue will be cleared off. What does it mean? You are opening the middle ear, see what is inside. Right? If the gelatinous tissue is still present, that means baby has not respired. If the gelatinous tissue is completely absent, if it is completely cleared, then you can see baby must have respired. That is why gelatinous tissue has completely cleared. This is called Redden's middle ear test, gelatin test. Very, very simple. Right? Now the last but not least, that is called hydrostatic test, wherein we are checking the lung flotation. Very, very important. It is also called as Breslau's first life test. It is also called as Raygaard's test. Right? Here we are checking the lung flotation. Right? Why we are checking lung flotation? The point is, I'll tell you the concept. See, normally what happens when the baby starts breathing, right? The specific gravity, it will change. Right? You can see the specific gravity of the unrespired lung, it is 1.040. When the baby starts breathing, the specific gravity of the respired lung, it becomes 0.940. 0.940. Fine. So the specific gravity comes down. So this test is basically on the specific gravity of the lung. Here we are checking the residual air. Right? We are not checking the tidal air. We are checking the residual air. Only when the baby starts complete respiration, you can see residual air will be there. That is what we are checking. Fine. Remember the specific gravity. Now what happens is, see, I'll tell you the simplified way. You can see that you take water. You say water has got specific gravity 1. You take something, put it into the water. See, you take something which has got specific gravity more than 1, put it into the water, it will sink. You take something with specific gravity less than 1, you put it in the water, it will float. As simple as that. You can see the unrespired lung will sink, while respired lung pieces will float. Right? It is done. But if you want to know the procedure, I'll tell you the procedure. You take a bowl. First, you take the hot block and lung block, hot and lung block together, put it into the water, look whether it is, check whether it is floating or sinking. Then you take only the lungs, right? You need to tie it here. Bronchus. You take the lungs, put it into the water, check whether it is floating or sinking. Now, you take pieces of lung. These are all the pieces of lung. Right? These are all the lung pieces. Now, put it into the water. If the lung pieces start sinking, that means baby is not respired. If in case the lung pieces start floating, then what you can do is take the lung piece, right? Take the lung piece. You can see when the lung pieces start floating, you can say that there is some air in the alveolus. But the point is, you want to know whether the lung piece, that flotation of the lung piece is due to residual air or tidal air. How will you find out? You take the lung piece, squeeze it, right? You put it in a tissue paper, squeeze it. When you squeeze it and then put it into the water, when you are squeezing, you are excluding the tidal air. Then you put it into the water. If it is floating, that confirms it was a residual air. That means the baby has definitely started respiring. As simple as that. That is the exact procedure that you need to know. But I already told you the concept of why it is floating, why it is sinking. Right? Right. Now, suppose this floating, it is due to residual air. But sometimes what if this floating is not due to decomposition? Right? Because decomposition also produces gas. You know gas production. We read in thanatology. How would you know it is not due to decomposition, it is due to only respiration? For that, what we can do is we can take liver piece as a control, solid organ. We can take liver piece. This is a liver piece. We can use liver piece as a control. Put it into the water. If the liver piece normally, ideally, usually it should sink, right? Because solid organ. But if the liver piece start floating, that means this is decomposition. There is no need to proceed the hydrostatic test at all, because the decomposition has started. It will make all the pieces to float only. Right? It may give you false positive hydrostatic test. So there is no need to go ahead with the test, because the liver piece control itself started floating. That is due to decomposition gas. Fine. Now, though you know all these things, I told you all these tests, right? What are the fallacies of hydrostatic test, right? Sometimes you may get false positive, sometimes you may get false negative. What is false positive? Baby has not given breathing, but still the lung pieces are floating. One of the important examples just now I told you, that is decomposition. It may be due to decomposition. For that, you need to take liver piece as a control, find out whether it is due to decomposition or not. Or it may be due to artificial respiration. That is also possible. False negative. Baby has respired, but still the lung piece is sinking. What is the reason? Maybe due to some infections, maybe due to congenital pneumonia, atelectasis, or the baby has not started breathing properly, feeble respiration. Not started complete respiration, only feeble respiration. That may be giving false negative result. Fine. So I've told you false positive. I've also told you false negative. There are situations where you don't have to do this hydrostatic test at all. Not needed at all. When you will not do this test, only when you are certain, only when you are sure, definitely it is dead born. Or when you are definitely sure, it is definitely live born. Either you know it is definitely dead born, or you know whether it is definitely live born, you will not do this test. Let us see the condition. Definitely dead born. How will you know it is definitely dead born? When the baby is a monstrous anomaly, baby cannot survive. IUD, mummification, maceration, you definitely know that is dead born. There is no need of hydrostatic test. Or when it is less than 180 days, it is not going to be viable. Baby cannot survive. You can definitely say that it is not a live born baby. Right? All these things you do in all these places, you don't have to do the test. Definitely live born. How would you know? Definitely baby should have been born alive and it has lived for a few days. Few hours at least. How would you know? Number one, milk in the stomach. Right? Milk in the stomach. The presence of milk in the stomach cavity, that means baby was alive for some time. Baby started having the milk. Right? The presence of milk in the gastric cavity itself says that baby must have been live born. Right? And the next important thing is, look at the umbilical cord. If you can able to see the healing of the umbilical cord, scarified tissue in the umbilical cord, umbilical cord tissue has completely healed, definitely the baby should have been alive for few days. Is it not? Live born. And the last one is, you look at the large intestine, there is no meconium at all. No absence of meconium in the large intestine. That means baby was alive for some time. It has passed meconium. Again, that is a sign of live born. Either you know it is definitely dead born, or you know it is definitely live born. There is no need of hydrostatic tests. That is what we were discussing so far. I was talking about the different tests, but let me summarize everything together. Right? Shape of the chest, flat becomes expanded. Right? Diaphragm, earlier it is 3rd to 4th rib, now it is 6 to 7 rib pushed down. Forward test, you know the weight of the lung, 30 grams becomes 60 grams. Plockiott's test, 1:70 becomes 1:35, right? And Redden's test, gelatinous tissue is present, baby not respired. Gelatin tissue absent, baby has respired. Breslow's second life test, if you are able to see the air bubble, baby respired. If there is no air bubble, baby not respired. And the last test is hydrostatic test. If the lung pieces sink, the baby has not respired. If the lung pieces float, the baby respired. So this is the summary of what we have seen so far. If you know at least this slide, you'll be able to answer the question. You'll be able to retain all the information that we have discussed so far. Fine. Right. Now, going forward, let us look at another important condition, that is nothing but battered baby syndrome. Battered baby syndrome, which is otherwise called as Keffe syndrome, Keffe-Kemp syndrome. It is also called as parent-infant traumatic stress syndrome. parent-infant traumatic stress syndrome. It is a kind of non-accidental violence. It is not accidental violence, non-accidental violence. Let us look at the definition. Who is a battered baby? A battered baby is one who has suffered, who has received repetitive physical injuries. Repetitive word is keyword. Repetitive physical injuries as a result of non-accidental violence. Non-accidental violence. Right? And it is produced by a parent or the caretaker, that is guardian. Right? Battered baby is one who has suffered repetitive injuries, physical injury due to non-accidental violence by a parent or the guardian. It is not only physical injury, there can be a abuse of nutritional, emotional, everything will be there. Right? Now, so when to suspect this battered baby syndrome, I'll tell you the salient feature, right? The injury, right? The injuries and the history given by the parent does not match at all, right? There is a discrepancy between the injury and the history given by the parent, right? You can see the parent might be telling the baby was walking, baby fell down, sustained that injury. But when you look at the injury, it will be a pinch mark, it will be a butterfly bruise, it will be a sixpenny bruise, cigarette butt injuries, all these injuries will be there. You can easily find out there is a discrepancy between the history given by the parent and the injuries which are there. Right? There will be a significant delay between the injury and the medical attention, which is not justified by the reason told by the parent. Significant delay. Right? And the third important thing is you can see multiple injuries of different ages. That is so important. When you are able to see multiple injuries of different ages, that means the child is subjected to chronic repetitive trauma. Right? 1 day old injury you can see, 4 days old you can see, 7 days bruises you can see 3 days healed injuries also there. Everything you can see in different ages. Multiple injuries or different ages suggestive of battered baby syndrome. What are the features that are related to child which are more associated with battered baby syndrome? See, this is normally more in a male child, right? More associated with male child. And this child is usually the eldest or the youngest, extreme. The child is usually an unwanted child. They did not want to have this child, but they could not do anything. It was an unwanted child, or many a times it is illegitimate child. Right? Unwanted child or illegitimate child. These are the factors. These children will be more suffering, will be the more usually the victims of this battered baby syndrome. Right? Now, look at the factors related to the parent. Usually, they are unmarried couple. The point is, these battering parent will usually be, when you look at their past, they might be the victims of child abuse. Right? And they have turned to be the battering parent. Right? They have turned out to be the battering parent. And many a times associated drug abuse among the parents noted. Many a times. Okay, so I've told you the features associated with the child, associated with the parent. I've also told you the classical features. There is a discrepancy between the history and the injury. There is a delay in the injury and the medical attention, and these multiple injuries of different ages. These are all the classical features. Now, what are all the classical injuries that you can notice? Do remember, the classical injury is the laceration of the oral mucosa. This is so important injury. Laceration of the oral mucosa. Many a times when the child is crying, the battering parent will try to hold the baby mouth, right? Will try to shut the baby, and there can be injuries. You can see the laceration of the oral mucosa. Sometimes you can see the injuries on the labia. Sometimes you can see the injuries on the frenulum. All this is most characteristic injury, right? Most characteristic injury for this condition, right? Apart from this injury, you can see the skin injuries. You can see the slap marks, right? They might be slapping the baby continuously. Lash marks, right? Pinch marks, you can see the butterfly bruises. You can see the butterfly bruises. And not only the butterfly bruises, you will also be able to find out the 6 penny bruises that will also be identified in this child, battered child, battered baby syndrome. Right, these are all the skin injuries. Not only this, you can also see the thermal injuries. What is a thermal injury? You can see the cigarette butt marking. Cigarette burns can be there. With the butt of cigarette, with the cigarette, burning cigarette, they'll put marking, burns, they'll inflict burns on the skin, the child. Cigarette burns can be noted. Not only cigarette burns, you can also see the injuries due to scalds, moist state. They will take the baby, there'll be boiling water, they'll dip the baby into the boiling water. You can see the scalds in the baby. Many a times when such a baby is being immersed into the boiling water, you can see the demarcation line will be there. That is again one more important feature. Right? So do remember, moist heat injury will also be there. Cigarette burns will be there. Scalds will be there. All these injuries are there. Look at the eye. Right? When you see the eye, what happens is you can see the eye, there can be retinal detachment. The retinal detachment can be due to violent shaking or due to slap marks. Right? Because of the direct injury, there can be retinal detachment. One of the most important feature that you have to know is CNS injuries, that is specifically seen with what is called as infantile whiplash syndrome. Right? Infantile whiplash syndrome, which is also called as shaken baby syndrome. What is that shaken baby syndrome? You can see the baby is continuously shaken by the parent. Right? Shaken baby syndrome. When the baby head keeps on moving like this, what happens is the baby can have one important triad. What is that triad? There can be a triad of SDH. There can be a triad of retinal detachment or retinal hemorrhage. In addition to that, there can also be encephalopathy. Right? When you see this triad, definitely it is suggestive of shaken baby syndrome. Shaken baby syndrome. In addition to this, you can also look at the presence of skeletal injuries. What are the skeletal injuries that you can notice? Right? You can look at the skeletal injuries in the skull, right? Wherein you can see what is called as eggshell fracture. There can be fracture of the skull vault. Not only that, particularly you can look at the fracture in the ribs, right? There can be a fracture in the posterior end of the ribs. You can see the fracture in the posterior end of the ribs. Not only that, you can also see the fracture in the mid-axillary line. Why specifically in these areas? Why specifically in the, you hold the child, right? When you hold the child, you have this antero-posterior compression, right? Antero-posterior compression, there can be stress in the mid-axillary line. You can have fracture over there, antero-posterior compression. Or when you have lateral compression, the stress is over the posterior end of the rib, that can get fracture, that is lateral compression. Right? These ribs, you can see as it starts healing, you can see some callus tissue. Right? When you take X-ray, you can see the callus tissue over there. We call it as beads appearance. Right? You can see sometimes they called a string of bead appearance, or you can say bead appearance, that you can notice in the ribs. And not only that, in the long bones, as well, particularly in the metaphyseal region, we can look at the presence of fractures. Right? What is that fracture? We have what is called as corner fracture. Another one is bucket handle fracture. Right? Corner fracture. Another one is bucket handle fracture. That is due to the shearing force, twisting the hand, twisting the hand, right? Or the baby is taken, continuously shaken like this, the legs will dangle, right? The legs move violently. There can be fracture of the metaphyseal region. We call it as bucket handle fracture, also called as corner fracture, wherein you can see this is your corner fracture and you can see the bucket handle fracture. Right? Very, very typical of your shaken baby syndrome. You can see, I told you the X-rays, you can see the callus tissue. I told you beads appearance, right? All this callus tissue can be noted. Fine. Now, what happens is, see, this is related to the baby. There are two sections that we have to know. Number one, 317 IPC, 318 IPC. What is that 317 IPC? 317 IPC is something which gives punishment for abandonment of the child. If anybody is abandoning the child less than 12 years, it is punishable under 317 IPC. Abandonment of the child less than 12 years. 318 IPC, concealment of the birth. Baby is born, suddenly dead. Even though the parent has not done anything, secretly they are burying the baby, disposing the baby, right? Disposing the body of the baby. Concealment of the birth, that is punishable under 318 IPC. All these are IPC. How can you remember? You can remember AC alphabetical wise. A for abandonment, 317 IPC. C for concealment, that is 318 IPC. Right? Battered baby syndrome. And in relation to that, I have told you the other sections as well, 317 and 318. Fine. Now going forward, let us see one more important syndrome, that is called Munchausen syndrome by proxy. That is so important. That is so important. This is not a type of the parent coming to the hospital frequently. No. Here, the parent fabricates a illness to the child, bringing the child to the hospital to gain attention. Right? It is a form of child abuse. It is a form of child abuse where the parent is inducing the illness to the child, bringing the child to the baby. The parent might induce diarrhea, vomiting, fever, seizures. Right? The parent, the mother or the father, they'll take a pin, they will prick the finger, blood is mixed to the urine, they will come to the hospital with the child telling that baby has got hematuria. They will give insulin to the baby will go in for hypoglycemia, they'll come to the hospital with child, suddenly they say the baby was normal, suddenly it has become unconscious, right? They will come with the vomiting, symptoms of vomiting, diarrhea, frequent diarrhea, right? Seizures, right? Fever, all these are the common symptoms the child is brought with. But do remember, it is the parent abusing the baby, child abuse, Munchausen syndrome by proxy. Right? Now, the child may be brought to the hospital with repeatedly. The child may be brought to the hospital repeatedly. I told you with a lot of non-specific complaints, vague complaints. Right? You can say it is vague complaint. Right? How do you find out whether it is Munchausen syndrome by proxy or not? When you look at the baby, the illness does not conform to any expected presentation. Right? It is not the expected presentation of the illness. So it will not confirm the expected presentation. Vague complaints will be there. Vague complaints. Right? When you look at the signs and symptoms, the signs and symptoms are not matching, are not substantiated, or you can say are not matching with the lab finding. Lab findings, everything appears to be normal. She brought the baby with a history of hematuria, but when you do urine test in the hospital, that happens to be normal, no hematuria. And she is telling that baby has got some abdominal pain, vomiting, diarrhea. When you do imaging, the imaging findings happens to be completely normal. Right? The signs and symptoms told by the parent does not match with the lab findings, the imaging findings at all. Particularly, the child become worse in the presence of parent. When the parent is there, child is becoming worse. When the parent is not there, in the absence of the parent, the child becomes better. Child becomes better. Right? So that is the most clinching thing that you have to note. And when you look at the previous history, the child must have been admitted to a lot of other hospitals. Child must have been admitted, right? Child admitted with multiple hospitals previously. Multiple hospitalizations must be there, multiple consultation must be there, multiple hospital visits must be there. So you can easily find out that it is the problem with the parent, not with the child. It is called Munchausen syndrome by proxy. Right? Another important syndrome, this is sudden infant death syndrome, which is also called as SIDS, also called as crib death, also called as cot death. Right? The baby is found dead. But here, what is the definition? It is a sudden, unexpected death of apparently healthy child. That is most important. The infant was apparently healthy only. Suddenly, you find the baby to be dead. But when you do investigations, the death remain unexplained. The death remain unexplained. You are not able to find out any kind of findings at all. Even though you have done complete investigations, you are not able to find out any finding at all. That is called sudden infant death syndrome. Sudden infant death syndrome. Let us look at the features of this case. In which, what are the factors that is associated with SIDS, sudden infant death syndrome? Age. When you look at the age group, you see it is very commonly seen around 2 months to 4 months. Right? 2 months to 4 months. During this period is very common. But that doesn't mean it is only it is common. It is seen only during this period. It can be seen as early as 2 weeks. It can be seen as later as 2 years. But common between 2 to 4 months. 2 to 4 months. Sex. Commonly seen among females. Female babies. Right? Twins, yes, more associated, more risk is there. When one of the baby of twin is died of SIDS, another baby has also got similar risk. More risk is there. Right? Time of death, commonly during early morning. Commonly during early morning. Right? And prematurity, more risk. More risk. So this SIDS has got more risk in alcohol, in a mother who is consuming alcohol and has got the habit of smoking cigarettes. Cigarette smoking and alcohol has got more risk of SIDS, right? What are the autopsy findings? I told you, in spite of doing all the investigation, you are not able to get any findings. So mostly autopsy findings will be negative. You don't get any kind of findings, specific findings you don't get. Right? You may see milk or bloodstained froth in the mouth and nostrils. The only consistent finding that you can notice is you will be able to find out the petechial hemorrhage. Petechial hemorrhages in the lungs, in the heart, and in the thymus. Right? But with this, it doesn't explain the death in this SIDS. It doesn't explain the death. Fine. What are the theories put forward? Many theories only. There is no particular cause of death which have been identified. It is only theory, right? First theory, the most important theory is prolonged sleep apnea, right? Prolonged sleep apnea is the most important one. It is accepted one also. Respiratory infection. Viremia, particularly when the infection is due to virus, they say that it is going to cause depression of the respiratory center. This will predispose the baby to sleep apnea. This will predispose the baby to prolonged sleep apnea, and that may be the reason of SIDS. Hypersensitivity to cow's milk. Other conditions are there. Hypoglycemia. There is deficiency of calcium, selenium deficiency. Many things have been proposed, but all these are only theories. All these are only theories. What are the medico-legal importance? Many a times what happens, the parents may be implicated for murder. Right? Parents may be implicated in murder in a case of sudden infant death syndrome. Not only, sometimes the reverse can happen. The parents might have killed the baby, but they might say that the baby died of sudden infant death syndrome. Infanticide case may be brought as SIDS. Right? Infanticide case may be brought as SIDS. Fine? Right? So these are all the medico-legal importance that you have to know with sudden infant death syndrome.